disposition. And other people develop physical problems early on, and it depends on how much you're using, what you use, what your genetic disposition is. So there's a lot of factors that go into it. But therapy and counseling can help. I think especially if you're sort of on that fringe area where you've had some consequences, but you're still in denial, you know, I think some treatment can help. And sometimes, unfortunately, it takes more severe consequences before someone finally decides to deal with their denial, you know, to break through their denial.
I've seen written, and I've heard it said that alcoholism left unchecked will kill you. Is that true? Just because if you live long enough, it'll finally just ruin your body?
Yeah, I think that there's, you know, again, it depends what you say. I see people from alcoholics die all the time, alcohol and drug addicts, literally. But it's not just, it's direct and indirect causes. In other words, it's medical problems, car wrecks, you know, health problems. People end up in jail. I mean, they may not die, people die spiritually even when they're not dying physically, you know. And so it is a devastating illness. It really affects people really in a lot of ways. And, you know, it's hard because, you know, I see people that literally, you know, dying from alcohol and drugs all the time. Seeing people in their 30s and 40s, it's amazing. But, you know, the problem is that usually, for example, you know, you get in a car wreck. A lot of times people think it's, well, you died in a car wreck. It wasn't really alcohol that killed, you know, it's a car wreck. You know? So, but it's, as I mentioned earlier on, it's a devastating illness. A lot of problems.
How do you treat gambling?
Gambling, again, is a process addiction, and it's a pathologic relationship with a mood-altering behavior. Pathologic relationship with a mood-altering behavior. In gambling, you know, you need to, just like with everything else, you have to have a behavioral intervention. You have to first stop the behavior. Like, okay, that's the first thing. You do that whether they need to be in a treatment setting where they can't gamble, or they need to be supervised where they're unable to gamble for a period of time. So you have to first stop the behavior. Then you have to start dealing with the underlying issues, just like, you know, trying to deal with some of the denial, deal with the consequences, just like with any other illness. And there's a 12-step program, Gamblers Anonymous, that works. Same principles. One is powerless over gambling, and their life is unmanageable. You got to talk about consequences and help the addict relate the consequences in his life to the behavior. So it's a combination of therapy, stopping the behavior, therapy, and 12-step recovery, and requires spiritual growth as well. So it's very similar to any other addiction. It's just a process. Yes, sir.
I'm throw you a low ball.
I'm sorry?
I'm going to throw you a low ball.
Okay.
What do you think the government programs do, like Just Say No and all these other things? But do you think they do any good at all?
Well, the National Institute on Drug Addiction just published a study. I almost hate telling people about this. They said in a recent study that treatment of less than 3 months is of little or no value. That's the National Institute on Drug Addiction. It's a scary thought, because I mean, people really need to have you know, some pretty good treatment. So unfortunately, you know, just saying no. I'm sorry, just saying no can work. It's really more of an educational thing. We think about treating addictions as, you know, primary treatment, secondary treatment, and tertiary treatment. Primary treatment might be just education, like teaching in our schools. Just say no, you know, having to educate them about drugs. Secondary prevention, it really has more to dealing with it when it's early consequences, you know, and then tertiary interventions have more to do with dealing with it once you have cirrhosis of the liver or something, you know, so you want to try and deal with it early on. Education can help. Once you become addicted and that addictive process is set up, I don't believe that just saying no is a solution. That might be a solution for somebody who hasn't yet, who might be an abuser that hasn't yet become addicted. Other questions?
Do you think
food can be an addiction?
Oh, absolutely. And now, I believe it is, and I don't have any of those slides with me, but they have studies, where they show how sugar, in particular, carbohydrates, can cause addictions. They've done studies with mice and rats, for example, where they've literally shown they do things like they take rats and they give them healthy pellets to eat, and they're normal body weight rats. And you take half of those rats and you put them in another cage where you give them high content sugar foods like potato chips and cookies or whatever. I don't know if that's actually what they eat, potato chips and cookies. And what happens to those rats? They get obese. They eat and eat and eat. Okay? There's something in the sugar and the fat content, the sugar content of those that they start eating compulsively. And then you take those rats and you give them a choice of pellets, healthy pellets, or cookies and junk food. What do you think they eat?
They're cookies.
Yeah. And then you take them and you put them back in a cage where all there is pellets, and what happens? They get back to normal weight, right? I mean, there's an addictive quality to the carbohydrates and the high sugar content. And, it's been proven. And it has to do with the same neurochemicals. It has to do with dopamine and pleasure centers in the brain. It's not quite the same penetrance of how it affects the dopamine levels isn't as direct. Personally don't know all the neurochemical connections in that, but surely it is. And the treatment of eating disorders or food problems, whether it's compulsive overeating or anorexia, bulimia, nervosa, there are programs that treat it as a 12-step program like an addiction. And there are some programs that treat it more like a psychiatric behavioral problem. And I personally think that there's some people that do better with one model than the other. And I think when you talk to them, you can get a sense of how much of their food problem seems to have an addictive quality to it. And then there's other people I see, they talk to them about their food problems. It doesn't seem like they have much of an addictive component to it. And I think bulimics, for example, generally do tend to have more of an addictive quality to it, whereas anorexics tend to not have that much of an addictive quality in general. The studies show that if you look at eating disorder people also, 60% of them have an alcoholic parent. 60% of eating disorder patients have an alcoholic parent. So there's a genetic connection there too.
What about somebody who has gotten into recovery from the nicotine and the drugs and the alcohol, but is eating themselves to death? It's like the addiction's still there. It's just in another area. Is there any kind of intervention that's ever come up with that?
Well, just, again, what you're talking about is what I like to call the, it's cross addiction really. Is, we've all probably had kids where, you used to, or grandkids where you buy those toys, and there's gophers and you gotta get the hammer, you gotta get them all 4 down at the same time. You get these 2 down and those 2 pop up. We see that all the time. That's what happens all the time at the hospital. I tell my folks, they come in the door and we take their alcohol and drugs away. And they hang out with their friends out on the smoke patio. They look forward to going down to the cafeteria and eating with their friends. And if we're not careful, they come in the door to Ridgeview and treat their alcohol and drugs. If we're not careful, they'll walk out the door smoking twice as much and having put on 20 pounds. Okay? So what we have to do is counsel them about cross addiction. Very common problem. The studies you talk about in nicotine, I personally have better statistics on nicotine. They show that kind of a scary thought, whether it's food or tobacco. Studies show that in 2006, there were more alcoholics that died from nicotine dependency and nicotine-related illness than alcohol. It's a scary thought. And 80% of the alcoholics smoke, whereas the general population is much
100% drink coffee.
About 100% drink coffee. Great meeting. So cross addiction is a big